Hi guys, Fraser from Harley Street Medics here in the Glasgow clinic, and today I wanted to quickly talk about something that is a very common problem that people struggle with, and that is acne scarring. With acne scarring, we tend to see what is known as atrophic scars, or scars that are pitted. There are many different types of pitted scars. There are rolling scars, there are box scars, and there are also ice pick scars. And we often see these types of scarring with people who have suffered with acne in the past, particularly more severe forms of acne, mostly on the temples and the cheeks, where we have this pitted appearance. What we like to do at the clinic is we deploy a very intensive treatment that uses a combination of different things. First of all, what we like to do is something called TCA CROSS, which uses a trichloroacetic acid chemical peel, and CROSS stands for Chemical Reconstruction of Skin Scars. This is applied to the base of the scar to help stimulate the collagen to lift the bottom of the scar up. And then what we also like to do is we like to use radiofrequency microneedling, and we utilize our Virtue RF device. If you guys have been following us for a while, you'll probably be familiar. And what this device does is it uses 36 gold-plated microneedles, and they enter the skin and deliver radiofrequency energy to break down scar tissue and to stimulate new collagen formation. And this is also fantastic because we get a little bit of LED light in there just to soothe the skin. I just want to show you up close what it looks like. And when we press the button, we get a couple of needles coming up here very quickly. And it's really nice and comfortable. A lot of the patients love this treatment because it can be used for more than just scarring. It can be used for skin rejuvenation, acne that's active, pigmentation, and rosacea as well. Our final step in the process is to use fractional CO2 laser resurfacing. And what this does is it vaporizes small columns in the skin to help to shrink down the scar tissue, further stimulate the collagen, and just provide an overall smoother surface to the skin. It helps fade any sort of superficial discoloration at the same time. And the reason we do this is because our Virtue RF is working deeper down in the skin towards the bottom of the scars. And then the fractional CO2 is working in a more superficial manner to smooth the surface. We usually do our treatments probably about 6 to 8 weeks apart to give the skin time to heal in between. The skin is going to take 3 months to show the full benefit of the treatment, so we don't want to pack too many treatments in too close together. And the last tool we have for rolling scars specifically is something called Subcision. When you have a rolling scar, there are fibrous bands that are pulling down on the skin and causing this rolling sort of pits and hills on the skin. We are able to, with a small cannula, enter underneath the skin to break these tetherings of scar tissue. And when we break them and release them from the upper layers of the skin begins to flatten out again. These treatments can actually all be done in one sitting. This is particularly good because it reduces the number of visits that you're having. And with CO2 resurfacing, there is a little bit of downtime. So you're looking at probably about 7 days to heal completely. The first 2 days are generally the worst, with some redness and swelling. After that, the most symptoms people experience is a little bit of crusting of the skin, which begins to quickly shed off towards day 7. And by day 7, usually our patients are asking, when can I come back in? I'm ready to go again. And we always do say, please give at least 6 to 8 weeks between, just to allow your skin to heal. So it's a very popular treatment. Our patients are loving the results. And we typically see people do between 4 to 6 treatments depending on the severity of the scarring that we're dealing with. If scarring is something that you're dealing with at the moment, we also deal with other types of scars such as hypertrophic scars and keloid scars. You can always, as you know, book in for a free online consultation with us. One of our consultants will be happy to discuss a treatment program with you, and we can get you into the clinic and start your journey from conscious to confident. Look forward to seeing you all again soon. Thanks.